Anybody in practice has to deal with challenging patients and scenarios, and yeah, you can empathise with members when they ring up, because, as you say, you've trodden that path yourselves, really.
Hello and welcome to In the Chair With, a series of dental protection podcasts. My name is Lesley Harrison. I'm a dentist and a dentolegal consultant here at Dental Protection. I'm hosting a series of short podcasts where I'll be interviewing dentists and other industry figures of interest within the dental community. I'll be talking to my guests about their career, their inspirations and aspirations. I guess I just want to know what makes them tick. I'm delighted today to speak with Dr. Richard Hartley. As some of you might know, Richard is one of my dentolegal consultant colleagues here at Dental Protection. He's also one of my closest friends. We qualified together in Newcastle in 1991, and as we had to sit in alphabetical order at dental school, there was no escaping him, and I haven't been able to get rid of him since. So the main reason I wanted to talk to Richard today was to find out more about his recent trip to Kenya to work as a dentist for a dental charity, but more about that later. I thought we should start at the beginning of your dental career, and I just wondered what made you want to be a dentist, because I've known you for so long, but I don't think I've ever actually asked you. So was it something that you always wanted to do when you were growing up?
I suppose for quite a while whilst I was growing up, I did. I wanted to do something in a sort of caring profession, I suppose, in sort of a medical type career, but I used to enjoy going to the dentist because I never really had anything done. So I just used to go and sit there, and they'd look and say, yeah, that's fine, see you in 6 months. And I thought, oh, I could probably do that.
So an easy job.
So looks reasonably straightforward, I'll go for that.
Well, a good enough a reason as any, I suppose. So moving on from qualifying in Newcastle, you then went on to own a dental practice, and you were a local dental advisor for many years and also taught at the Leeds Dental Institute. So tell me about that, because I know you were involved with outreach there, weren't you?
Yeah, I suppose looking back at my career, I had a practice until about 2006 in Huddersfield. And from about 2002, 2003, I'd started just going in one day a week into the dental school on a Friday just to teach the students. And I found I was really enjoying that, probably more than the actual general practice side of things. And so I sort of gradually moved over, doing less clinical work and more of the teaching, and eventually sold the practice, as I say, in 2006 to go and work at the Dental Institute full time. And as part of that, I was involved in setting up the outreach clinic in Beeston in Leeds, and taught there probably until about 2011, 2012. But alongside that, I started as a local dental advisor with Dental Protection, a role that doesn't really exist anymore. But at that time, local dental advisors went into practices with members who were, perhaps had GDC investigations or were struggling in other ways, just to do a bit of sort of troubleshooting. And I was doing that just ad hoc, really, as and when, and found that I was enjoying that more than perhaps the teaching side, and moved across, eventually becoming a dental legal consultant with Dental Protection.
So what do you enjoy most about your job as a DLC?
Just the variety, I think, really. I mean, obviously, if you similar, I suppose, to going into a caring profession, you want to sort of look after people and help where you can, and this job allows you to do that in various different ways, from answering questions on our telephone advice line, helping people with complaints that may come in. It allows you to sort of discuss with other colleagues problem solving and troubleshooting in relation to sort of difficult scenarios that sometimes members present to us. And it also allows you to work with other members of the team, such as, solicitors, barristers, and just brings in a wide variety of different experiences and challenges, I would say. So, it becomes a very interesting job.
And I think we can use our experience in practice, can't we, as well? Because a lot of the complaints that come through, we could quite easily have been in that situation and dealt with sort of similar challenging patients. So I think dentists enjoy talking to us because they know that we have possibly been there and done it as well.
Yes, we've definitely been there. Yeah, obviously, anybody in practice has to deal with challenging patients and scenarios, and yeah, you can empathise with members when they ring up because, as you say, you've trodden that path yourselves, really.
So we've now been working in dentistry for over 30 years, but do you know what? That just makes me feel so old. But I just wondered what changes you've noticed in that time.
I suppose we've seen quite a rapid change recently, haven't we, in the application of technology in dentistry. I mean, it's moving swiftly. The focus is more towards sort of cosmetic dentistry, adult orthodontics with aligners. Dental materials are moving on. We've got digital dentistry coming more to the fore now, with the use of scanners and that sort of thing. I think it has changed quite a bit, perhaps in more recent times rather than earlier in our career. I mean, I'd be interested to see how AI starts to affect dentistry moving forward. We've already got sort of programs that help with record keeping and that sort of thing. And I think it'll be an interesting time. I expect things to change quite rapidly over the next few years as well.
Yeah, no, I agree. Very different to when we first started. But moving on to more recent times. So you went to Kenya last year as part of a team for a dental charity. So tell me about that.
Yeah, it was a couple of years ago. I was chatting with Mitesh, who we both know because he was in our year at dental school, and he set up a charity called Smile Star in 2010 with the aim of providing free dental care to disadvantaged communities in Africa and in India, because I think his parents were Indian, but he grew up in Kenya. So I think he wanted to give something back to both those countries. And they also provide free dental care to ex-Marines in the UK. So there's a number of practices who have sort of joined up to provide dental care to ex-Royal Marines. And so I got chatting to Mitesh and said I was interested in helping out. So he said he would send me the details through the next few trips they were going on. And so I elected to go on a 2-week trip to Kenya in November. We flew into Nairobi and then had about a 5-hour road trip to an area called Nyeri, where we treated patients in a variety of settings there. Just setting up camp, I suppose you would call it, in a local primary school and in a local lodge, treating members of the local community there.
So what type of equipment did you have? Was it really basic or?
Well, the only treatment we provide really is checkups and extractions. There weren't facilities to do anything more advanced than that. And so we had, all the dental instruments that you would need to carry out extractions. But the chairs were whatever chairs were available in the various areas we went to, sort of stackable chairs in the school, and some garden sort of stackable chairs in the lodge, etc. And really it's just a case of having a head torch on.
And doing what you can, I suppose, isn't it?
But we were sort of treating, between 100 and 200 patients a day.
By me.
And there were a team of about 11 of us, including dental nurses and dental therapists, who were sort of assisting with the sterilisation of instruments and chairside assistants as well, and a whole range of patients, from youngsters who were about 4 up to people in the 90s, really.
Wow. But how did you feel on day one, being back at the coalface after doing non-clinical work for such a long time? I think I would have been terrified.
Yeah, absolutely terrified, obviously. But the team are really supportive, and I have to say, once the first local anaesthetic was in, it was like riding a bike. I was off. It was fine, and it was great to sort of be back, doing hands-on dentistry again. I really enjoyed it.
So were there any parts you didn't enjoy?
No, not really. There was a great bunch of people, I suppose like-minded people, who were wanting to go out and sort of carry out the charity work. Some of the travelling was tiring, as you might expect, but no, I mean, I think it was such a great experience, because not only was it the dentistry, you get to see parts of the country and experience things that you would never do as a tourist. I mean, when we on our trip, Mitesh had managed to gain access to a high security prison, and it was one of the first Western charities, and I think the first Western charity carrying out dental work to be allowed access to a high security prison. So, as you can imagine, that was rather daunting. going through the gates
And then being locked behind you.
and then being locked behind. Yes, but I have to say that the prisoners were a delight to treat, and were very grateful, and it was a fantastic experience.
No, it sounds it. So just thinking about people listening to this podcast who might be thinking of doing an elective as part of their undergraduate course or working abroad or perhaps doing charity work like you've done, is there anything you wish you'd known before you went?
I suppose well, first of all, I would say definitely go for it. I think it was a fantastic experience, and one that I'll reflect on for years to come, I'm sure. I think maybe just from a practical point of view, it was amazing how grateful the patients were for just small items such as toothbrushes and little samples of toothpaste. Well, we did take a lot with us, but prevention, as in a lot of these things, is the key. So they don't have access necessarily to getting toothbrushes and toothpaste because of the cost of them. And so I would say collect as much as you can before you go. And also, the kids love things like colouring books, pencils, little toy cars, and the adults would really appreciate sort of clothing items and that sort of thing. So I think I probably hadn't really considered before we went how important it was to take things like that with us, and how little they had really.
I think that's a really good tip. I seem to remember when we went to India a few years ago that we took pens and pencils and colouring books and some toys with us to give to the children that we met. And I think obviously taking toothbrushes and toothpaste will help patients that you've treated to be able to continue to look after their own teeth. But I think more importantly, it's situations like this that make you realise how much we take for granted. And we shouldn't forget that there are some people who are perhaps not quite as fortunate as us and they don't have access to basic commodities. So, any other handy tips?
Be prepared for the unexpected. I would say, which you could perhaps apply to dentistry in general, I suspect.
Well, I would say I think you need to, if you get offered the experience to do work abroad, do an elective or charity work, I think go for it, as Richard said. I think enjoy it, make the most of it. You're going to be seeing different places, you're meeting different people, and you're experiencing different cultures. So I think it's well worth doing, and it's an experience that will stay with you for a long time. Moving back onto your varied career, what professional achievement are you the most proud of?
I suppose it's probably being appointed as a dentolegal consultant.
Yeah, mine too.
I think you'll agree that there's a lot of competition for the role, and I really didn't think I would get appointed, so I was thrilled when I was appointed. And I suppose when you start out in your career, you never really think about where you might end up, apart from working in general practice. So to sort of moved away from that via teaching to get to the dental legal consultant role was something I'd never anticipated or imagined could be possible. So I would say that was probably what I'm most proud of.
Yeah, and I think it just goes to show that just because you have a dental degree doesn't mean that you are confined to just working in practice. There's lots of other options available to you.
Yeah, absolutely.
So moving on, my next question, what 3 words would you use to describe yourself? Do you want to hear mine first? My 3 would be kind, loyal, and witty.
Oh, right. Thank you. Well, I suppose perhaps on the vein, I've put reliable, which sounds really boring and dull, doesn't it?
But you are,
Uh,
you are. Not dull or boring, but reliable.
Humorous and generous. So I suppose that they're similar ones.
Yeah, they are. They are. And finally, what 3 things would you take to a desert island? So I'm going to allow you as a dentist to take your toothpaste, toothbrush, and floss. But what are the 3 things would you take?
Well, I suppose you're thinking about the desert island disc rules. I'm probably not allowed to take the dogs, am I? So
No.
I was going to say a picture of the dogs,
Yeah?
a fully stocked wine fridge,
Obs? Yes.
and a mosquito net because I hate being bitten by mozzies.
Oh, gosh, you do. Yes. Yes. Anyway, thank you so much for your time. It's been lovely to chat to you. Finally, if you're a dental student and you've been inspired by Richard's travels and work overseas, there's loads more information on the Dental Protection website about electives. You just need to search using the words your elective, and you'll find information on funding, top tips, and a travel checklist, and so much more. And it's also just worthwhile pointing out that all our student members get free protection for electives. All you need to do is let us know when and where you're going, and we'll make sure that you're protected. And with that, we've come to the end of our podcast. I've been your host, Lesley Harrison, and thank you so much for listening.